Okay, now kisim this blood book, please blood system. Only start this blood book. You place master. Morning, Ogada. Morning. Thank you. Morning, all fire service, fire team. Thank you, Loiba. Secondly, thank you, Loiba Kam. I think Mr. Nawi organizing facilities for Loiba assisting. All right. Thank you. Apologies long from Peter Pindan. And everyone but Zoom conference now morning, so he's in the room attending to that. Probably as we progress, he will come and join us later. Good. You know what I said also, display me training, you know, lining or working accreditation, accreditation, working integrated checklist. So after the display, you by kissing certificate law, internal certificate law, this a checklist, on Friday. So that means it's very important that you must be competent, you must have confidence, you must show yourself you by carrying this task and facilities. Time you finishing this program, you go back to facilities for you. And now you by survey also standards and also by lining on Marblano and facilities too. On the map you work and make sure only up to standard. Because one time I external line back up now on assessing facilities blah. Now I'm showing through you walk or you plan to walk on external line back I'm not talking so maybe training more tasso. It look also you got some division that's not yet. So I mean very important also you must understand in this block. You only walking this block or walking plus of the walk. So you mean making easy, or you understand now? But you pick up now because you got background knowledge, experience, or skills finish. Now you go back and by easy. So once you understand in this plan, let me see now. So I think as we go through you one by easy you but no start. Say hard click. So because I'm taking components now you one player facility. And now I'm good, you found the league now in the cost in time. So you must survey good, working practical good, you understand and go as well and you asking question like kissing answers. The second important point is when you are assessing a facility, that facility must be aware that you are going there. So all get a booklet number or something, all must put him in order. So when you go there, and they will have almost rousing person again. You're not going to go now to where start going and finding me at long. And more make sure that everything's there. If it is not there, then it's not there. All right, you're opening the page, I think page 2, huh? This page. Yeah, I understand that. So, okay, the facilities must start. If not more time. I'm alright, you may continue.
Yes.
Leadership and management, and by Tok Law, OIC. Okay, the question by Kisim OIC. Okay, outreach and FHC, family health. Okay, and by Sim this plan, family health. So you're not looking at that's how you will. So each section you're not making, make sure you go. I think any good plan no family health, you go section, family health section work in this plan. You go essential drugs and you go pharmacy. So you're like asking or looking on something on them. Maternal or reproductive, you go OHIO, man. This plan. Suppose you plan sabe, but checking no way. Okay, go checking na toksabe. No go divla na found so. You let ma checking na toksabe. Go front page where all acronym stuff. I think it's page 2. OHIO, it's not there. So what is who leads this one? Maternal and reproductive health services. Family health. Okay, then that information will come from the family health. You know what I agree, yeah? Okay. FHC, and finish child and family health and bloody. Communicable diseases prevention and control. DDCO, this is control officer. Okay. So all of you must speak the same language because nobody will ask him wrong question.
Doctor, we don't have DDCO in some of our facilities. Can you put the OIC there in place?
Well, that's why you are the very experts and, you have all the knowledge background. So if you don't have this one, you go back to the appropriate person, appropriate lead in the facility. Yeah. All right. This is just to give you a guide. So I'm clear, huh? Suppose I'm not stop them over up a phone back no OIC no facility. But it is important that you go to the specific offices or sections where they operate. So that's where you find the booklets and everything there. Okay. So when you are moving, you have to organize. You go to the health facility and if you find that some of these offices are not there, then you tell the OIC, all these information will get it from you. So now by go to health facility na ibla to organize ma. Talk one them OIC na to these are the people we need to speak to, and these are the sections that we'll be going in assessment. You can ask him start with more. Ibla clear. After making excessive log one block component now and entire taken component and by log. So it is important that you are all clear. All right. Leadership and management. I've got 9 questions start. Okay, you go to this page. Page number 1. Page 7. Okay, leadership and management. I've got 9 questions. Someone saying out. Each question I've got a mass points. 2. Someone saying out, and maximum 1. And maximum 18 out of 18. So suppose saying out, and maximum 18. Now you are assessing some function and by staff knowledge health facility. So this question is not applicable. Suppose I'm applicable. Make sure you rouse him no here, not consent. Or total question maybe ask him 6 plus. So now possible score by everyone 12 out of 12. Suppose I'm won't get a 6 plus right. Am I right? Also make him comment school 5 out of 5, 6 out of 6. No, it's like 5 So suppose one black question teacher, straight remember talk, okay, me rousing this black question, so now we put him go down 4 out of 4. So nil applicables, NAs are like that. You just remove it. And make sure you remove it in the total possible score as well. Look at Baila, make him go low straight there. Down by 1 month. Am I right? Workforce by that. Total questions and 13 black questions. So out of 26, each question worth 2 points. Am I right? So make sure before you total him, you must rouse your nil applicable past them. Look at what you plan. I say if you make sense, if you make him some like NA2 or not. Yeah, also, yeah, practical also. Suppose you know some like NA2 by good platoon, so if you it's how you implement it. Okay, now you understand that, you go to next time. So I'm going to take plan one kind of so no, I don't plan. So total possible score, not going to be seen on this plan. Once you like seeing this plan right, and you like him total in Pamplona. Because NA by changing on total possible total scores, yeah, bottom there. Am I right now? Some last keep stop. Ask him stop or not. All right. Summary result table. And summary now by new. Just by working by making up with the entering. Okay. Leadership and management. Suppose in 10 out of 10, put in 10 lawyer. Now multiply by 100. So by giving a percentage. Suppose in 10 out of 10, now you multiply by 100 the maximum. 100%. I'm more than make it go there. Suppose in 5 out of 10, you multiply by 100 and by 50%. I'm clear. Out of clear. Let me see here. And it has solved by confusion you black. So rousing not total score past them before you black making. Some sort of function in our black, you black must tintin or rousing, not lose tintin. Because you black include any now, but confusing scores with black. I'm clear over there, I'm saying that's what. Go down. Okay. Now, go on our next page. I'm on good la book on walking. Writing on the pencil. So you black by keeping on this black book. Also important resource with black. I'm strong on pages too, yeah, and good la pages. So you black by keeping so writing on the pencil. One black assault. Book by like him now sick layer. Me blamas writing good one and Byron. One black. One black group by entering Mongeda no one black book person. Oh Stephen Police, good morning. Am I right there? So if black go down, okay. Name level facility, LG, facility level, catchment population, name blah. Email address not going to visit. Interview, contact, date of visit. Just fill in what this no more something because I fill it. Okay, so fill in this table here. Name, assessor, assessor 1, assessor 2, assessor 3, assessor 4. So I must fill assessor if I can fill in this table. I have information, just basic background information now. You've learned. Okay, if there's any general comments about the facility, any general comments? You can put any general comments, road blockage or power problem or any general comments you think, it's applicable, you put it here. All right, now you may go down the actual activities play me now. So, what are these page? Okay, now I'm entering score you are making, ask them. Anta we entering names, we facility, catchment population, on get making finish. Now you remember, ask them practical play me, and now you remember entering. As they make even practical reply, I'm also saying all get a bone on one line facility. That's all. One black group, I'm working leadership and management. Another black group, I'm working second component. Another plus, so you amas 11 player, you working one get. So now you may by using this plan, give him score. Then by working percentage rating, I put in a risk matrix, now you by looking. You may by working now. Okay. So who said which group I'm working leadership and management? Okay. By making scores with that now.
Okay. For point number 1, we scored 2.
We scored 2, huh?
Yeah.
Okay.
Point number 2, we scored 1.
1.
Point number 3, 1.
Point
number 4, 1.
4 is 1, huh?
Yeah. 5 is 2.
5 is 2.
6, 1.
6 is 1.
1. 7 is 2.
7 is 2.
8, 2, and 9, 2.
7, 2.
8,
8 is 2.
and 9 is 2.
9 is 2.
So we had a total of 14 points.
Total score?
14 out of 18.
Total is 14 out of 18, huh?
Yeah, 14 out of 18.
No NAs, huh?
No NAs.
Okay. So before you are totally over the time to make sure that there is no NAs. So total is 14 out of 18.
Yes.
1 4.
Our percentage is 78%.
So time you calculating 14 out of 18 times 100 and which how much?
78%.
78%. Okay. I just put it here. 78%. Oh, sorry. Antason, yang clear. Antason. Maybe remodify this line or option is not confusion because you're looking two black column and confused. One column, not black column, two column, not black column, I'm not straight up. But I put in one black column, that's all. You put in 2, 1, any, all get on the same column. And maybe we have a workman behind. But now how I'm making them just entering that's all. Okay, so I'm to 78%. Leadership. Hey, you got some more questions stuff or not? No, I don't. Just you're doing okay? 78, confirm that.
Sorry, 77.
77, right?
77.7.
Oh, yeah, round it up, round it up. Yeah, round it up. All that time round it. Making Excel trick in reply. Okay, which group working workforce? Okay, good. All right. First question. 1. Second question 2. Third question 0. Fourth question 2. Fifth question 2. 6 0 7
1.
Okay, 1. Okay, 8 0 9
1.
okay, 1 10
1.
1. All right, we'll go down. 11.
1,
11 is 1. 12. 2. 13. 2. No any here. So that means the entire question remains. Okay. All right, so total 15 over 26. 15 over 26. Okay, percentage. 15 over 26 times 100. Not calculator. 58%. Eh?
Yeah.
58. 58. Because any, look at any, so you may add him over there. You got some more question or won't give him 0? You may rouse him 0 to no question or no got? 0 must start. Because function of facility I'm not performing so. And you give him 0 so you can make him next time up. So 0 is included in that whole scores. So we are not removing any numbers up. I'm clear, huh? Okay. All right, let's go. What's that about outreach? One now. First question, Anna?
2,
2. Okay, question 2.
1,
1. Sorry, 2 should go there.
question 1 again.
1. Okay, question 3. 2. Question 4. 2. Okay. Question 5. 2. Question 6.
1,
1. 7.
1,
1. 8. 1 is there. That's why we'll remove those columns. It's just unnecessary. Sorry, I didn't do this one. I'll make them finish later. Question 8. 2. Question 9. 2. Question 10. 2. 11. 2. 12. 2. Okay. 13. 2. No NAs? Okay, total? 23 out of 26. Percentage? 88.4. Okay, if we round it down, then it will be 88%. Okay. If like clear or this bar. This one line, give him one line, any line. Because logo they don't facility now. Okay, supportive supervision. Supportive supervision. Okay, supportive supervision, we start working. Group 4, please. In micro, group 4. Thank you.
Okay, measurement indicator 4, supportive supervision, group 4. Number of items and 5 lang. So item 1, 0.
0. Sorry.
Item 2, 0. Item 3, 2. Item 4, 1. Item 5, 0. Total score 3 on 10.
Item 5 is 0, huh?
Yes.
Total score?
3 on 0. Sorry, 3 on 10. 3 on 10, thank you.
3 on 10. Good. Percentage? Total percentage?
We didn't do the percentage, so I thought we were going to head up and do the whole percentage.
No, the percentage.
Sorry. It's 30%, I guess,
33%,
right?
33.333%. Right, no, we don't let's say. It's correct.
30.
33. 30 or 33?
30%.
30%. All right, good. Now, next group, health information. Okay, Mike to health information, please. Like Lady said, just say the total items you have, and then you can say this number of items for NA, and if you have any NA, you can always say it. So say, okay,
You don't have any.
You don't have any NA, okay. So you, all right, go ahead. Health information.
Team number 5, our section heading was health information.
How many items do you have?
We have 14 items,
Good. Okay.
and our measuring indicator number 1, 0, number 2, 2, number 3, 1, number 4, 2,
Sorry.
3 is 1, sorry,
4.
4, 2, 5, 2,
Sorry, computer, keep up on the emission. 4 is 2. 5.
5, 2,
6.
6, 2,
7.
1,
1. 8.
2,
9.
1,
No, sorry, you put in the 1 first. 10.
2,
11.
1,
It's very unnecessary of creating blank column like causing inconveniences. 12.
1,
13.
0,
14.
2.
All right, total score.
19 out of 28.
19 out of 28.
19 divided by 28 times 100 over 1 was 67.8%, round off to 68%.
Good. Good. All right. That's done. Okay, next, essential drugs and supplies management. What's that book of essential drugs, supplies and management? Okay. First one.
Group number 6, we have 11 items.
Good.
Item number 1 is a 2.
2.
Item number 2, 0.
0.
Item number 3, 0. Item number 4, 2.
0. Item number 4 is 2.
Item number 5 is a 2.
Item number 5 is 2.
Item number 6 is a 2.
Let's take it easy, Abby. 2. Item number 6 is? Item number 6.
2.
Item 7.
Item 7, 0.
0.
Item 8, 2.
Item 8 is 2.
Item 9, 2.
Item 10.
Item 10, 0.
0. Can we just say NA there and we can explain? Because it's practical, so can we say NA in item 9? Let's for practical purposes, can we say NA?
Yes.
Okay. Now we are saying NA. All right. Item 10?
Item 10, 0.
0. 11?
Item 11, NA.
Ah, good. Well done. At least 2 with NA.
So,
Okay, good. Now, what was the beginning? How many total items did you have?
11.
11. So you have 2 NAs. So that means now how many total items you have?
9.
9. So now you're going to work with 9. All right, what's the total score? Total score is 18 now. No, the total score that you've given. What?
22.
22 ah.
Oh, now that
The current total score. Add them all up. All the scores that you've given so far, you add them up. Dapat na, hindi mo kira come down.
10.
Huh? First one now. 2. Ini di teman. Oh, ini di mana? Oh, berat mana mulai dari mana? Apa? Begini. Ini di mana? Total amas.
10. 20.
10 ah. Total score beli 10. Okay. Am I out of
22.
10 over? I've got 11 plus 11 items. So that's a total of 22. But then we subtracted. Yes. So now you will have 9. 9 times 2 will be 18. So it's 10 over 18. It's not clear. The percentage rating by 1. 10 over 18 times 100.
55.5% rounded off to 56%.
56%.
Yes.
Thank you. Good one. Okay, maternal reproductive health. What's that? Which group working maternal reproductive health? Give a mic long. Yeah, give a mic long, please. Just okay? Yes. Thank you.
Samuel Bong.
All right, maternal reproductive health.
Okay, group 7. Milfoteven Aman Clinic. Scope lumibla sana posem 1.
1.
Point belum bilang 1,
Uh-huh.
2, 1.
So, take it easy. Question 2 and 2.
Question.
Right.
Thank you. Thank you for this very important workshop. My comment is we are assessing the entire facility per all those different headings given. But like if I am to do the assessment for the program I am coordinating, in this case malaria, I'll use the same principle and develop the key items and then assess.
Sure.
So we'll see per facility what's their performance in the malaria program per facility.
In terms of standards.
So I'm all right, huh?
I'm all right.
Okay, thank you. Next is the correction on page 26 under clinical governance, patient care. Under patient care, page 26, it says mosquito nets are made available for all patients. According to the program, we don't issue nets to the health facility for inpatients. It's only, the nets we issue are for antenatal mothers, and we issue to the households back in the village. So I would think that this item is non-applicable.
Okay. If it is not applicable, then it's NA.
Yeah.
If you think, with your expertise, you're an expert, with your expertise, if you think it's NA, put NA. If you think the item should be there, but it's not there, then make recommendations in short and clear recommendations.
No, I am making this comment for the correction here across the country because we plan to give net law health facility for inpatients. We only issue net to the health facility who are providing antenatal care and to the households back in their respective communities. So I am suggesting, or I am asking, if this item will be removed or rewritten as maybe under family health service, ANC nets available at the health facility, but not for all inpatients.
I'd like you to make that recommendation and send it to us so we can take up. I think this document is going to be reviewed. You can see that these questionnaires are general for all the levels, level 4 to 2. However, now we are working on the level 4 facility separately. So after the media review, 2025 review, you will see a level 4 health facility specific checklist for itself. Because level 4 health facility provides a lot of services that are not captured in this general checklist matrix that we are using. So that one will come after 2025. But for now, we are using these ones. But if you find that some of the programs need adjustment or should be in some levels, and if they are not there, then flag it up so we can bring it up for review of this checklist as well.
Thank you.
Yeah. Take note, please. Yeah.
Hello, sorry. It's a tool, assessment tool now you may go through is very important. But those comments are very good. Maybe like Sarano working similar training on Arla PHH, they made similar comments, some of one and we take note. So this is a tool that maybe like you seem helping Yumieta long walk with the areas, standard areas that we need to iron out now, make sure that our activities are compliant with standards. So sunflower you think was relevant now? People you're right, but now we need our services some one may change the one. Please iron out now by helping me plus so when we can look through now, redoing rewrite or browsing or whatever we can do to suit our current set. So thank you very much. Now, then we go through, Dr. Go through, please raise up and make comments like that. So it helps us all to help our activity. So thank you, we take note of that. Another thing is I think one question or comment was the 100% kit. This level not something, so I think the question is there in one not so there is nothing that you like take note whether currently you play use him or it has been changed or it's like so those are some points that please people are raising now will help this activity and helping you so our activity what we are doing is compliance with standards. Thank you.
Thank you. Next also, recommendations are important. Once I'm looking at like Rabon, but go back to recommendations to black.
Thank you. Thank you for this training. I just want to make a comment on the NA. This is a standard, national health standards that we are going through. The one NA does the, like for example, coordinator malaria talk, and then we had one also NA. Does that, should that be included as a standard? Should it be included as a standard that each health facility health facility must or should have? Like for example, the net. Should we have all patients? Some of them they take the nets to the health facility and all sleep on nets. So should we as under the health standard, should it be part of the health standard at the hospital? So the NA wants me just asking because you mean Rausim na am part of the standard or something? Me just
that's a good question. Flag him, manam subject thing, flag it up. This checklist here, it's a general checklist and general. So functions from level 4, kind of an example, and by operating. So when you look at one black question, and by start on operation side. But you assessing level 2, now you by looking at the same question by start because you're using the same booklet across the board. Now I'm no function on level 2. So same must have NA. Because I'm no function on level 2, function on level 4. Yeah. It's not specific level specific, it captures all the levels. Yeah. So that's why you as an experienced expert person on the ground, you know what functions are there, so that's why you will give a NA. If you think that function should be there and it's not there, then give him 0. Not gonna worry, give him 0. So everybody Abiano restaurant now, they will go back and look at their booklets. So that's why when you're doing the booklet, each group, one booklet, clear handwriting, write it clearly, and then recommendations must be short and sharp. Not writing bloody recommendation, you not bloody space. You not writing bloody and by putting bloody example, na woman by not understand. Thinking good, na writing 2-3 words only. So I'm on stuff of strategic positions, and they will pick it up very quickly. This analyzed data is telling the whole story. Because after all this plan, the next time we come, we want to see improvements. We want to see a supportive supervision to be out there. The next time, if we come, the supportive supervision is still there, then there's a serious problem. So administration by Warilo, this plan, I'm going to make sure that they create systems and processes to tackle that issue. From the line of backside, so maybe you can ask him if you are giving that backside.
Okay,
Mrs. Dr. Toto Misality, you will more of a PHA. I think, Lord, every meeting do me well last year. We believe you touching this or rest on a functions or facility, but think in group and list him on. So you mean no one excuse me, you learning finish. You more of a page, you go, you should stay there and you can be talking about one road level 1, level 2, come and level 4, you've been working. Yes or no? So, Dr. Toto, what did you go through them? So you say one function to level 1, one safety is supposed to start to level 1, and you go through the review meeting during the last year. So, we hope also this level will meet with us. So, at the time, I question and I say, but there's something you learn in Finnish law, review meeting. So, if you participate in the last review meeting, this activity, you go through them. So, and by helping you law, working. Analysis plan and total NA this la you say was one function to level 2 level 1 you was a sim you not sim function to level 2 one time put in yes no you say was a function must level 1 you miss our finish just making clear also. Thank you.
Thank you, Chair. Miga, Sambla Totoglo making lo page 26 here. Boss Mayiblu Mararia walking Totoglo in there. Sambla blow this reports or information by maximum all records. Records means you got all documents stuff by you must begin. And how by you play can give me blah or Sambla thinking long or district health facilities. Suppose you play that. It kind of Law item 4, and to did this health facility record reports any adverse drug reactions in the last 3 months? So by me must go records na looking lo confirming true and I'm making. Another plan 3 incident register. Long district, me work several health centers. We hardly have these registers. And now you by God this plan me believe. But M1 is, do you have a standard register books or you play the creating sample or documents or books where you guys are working reporting from end? Since this one is to be standardized, Mr. Manning's National Health Service standards, if we don't have and we go our own ways to develop register books and all this, if there is a case, can we standardize over this lab because each National Health Service standards limit that we have to do assessment. Can we have for more PHA? Can we have all this developed in uniform way so that any staff in place over the whole facilities by you got all these incidents come up or whatever heavy come up, you may enter in a report, so you may report no harm. Otherwise. And this is something you start here by you working assessment or you may work assessment by you start. You may talk about wise or creating or help facilities or creating. And you may give on help and next time you may go back, we believe same heavy stuff yet. So how can we help them? Me losing on them online loan PHA from Morobe yet. Suppose you stop you never go and now you play by giving some last year, suppose you play so you got this plow or something stuff you play registering more cases or something. Now respond long and thank you.
Thank you. Time in writing recommendations. Those recommendations Sambla if on health facility line yet they're making. Only something on some cleaning, putting order books in order and all those ones. Sambla PHA by making. Sambla National Department of Health by making. So, you know, one tasson by making, all get a line by making because you might look on some things they could have done, but they haven't done it in their facilities, given the resources they have. So, once you put in a recommendation, and now I'm work for Stephen, Tim Longham, Karim Gohanda, and then identify the recommendations and group them into areas. Suppose I'm looking also health facility, one then resource, current resource am I making, and my next one some more making. Suppose some standardized booklets now this stuff it needs to come from the national health department and by flagging commandant no office lo pita pina. So good luck question, good luck statement. We are taking note of it. And every time we go, you know, people will always give us very important ideas, so we take note and then we flag it up. But on semi talk, make sure you put recommendations so that they will put their recommendations, and then on by delegating which category of people will assist. Not only PHA will work, not only the health facility will do, it's a big approach from all the health service system.
Thank you. In response, yes, not at the PHA level, we have many technical work to develop any tools in terms of collecting data at the facility level. We have many technical work and we have the terms of reference or policy that any tools that they use to collect data must be approved by this committee. Because the committee staff, so we plan on accepting one individual or come at all whatever. We plan on working on the template unified all across our facility. In consultation with our NDOH team. So you put a resolution also. You want something to start now, you need to develop. We will develop at the provincial level and distribute it to the facility level. Thank you.
Good one.
I just want to comment on adverse drug reaction. I think there is a format. There is a form that you will fill. In the TB program, I've cited it. So it's kind of like not specific to TB program, it's for the department. There is adverse drug reaction reporting form. Suppose you know a report now and by you know nabsavel on this platform.
Correct. Suppose, you know, clear or adverse drug reaction form, make mention that that information has not been trickled to our level, so that, you know, it's important that you know there's a form that's existing, so you by filling. All health facilities by filling. ADR form is important for them, so straight long, it's a department. But MI council or hospital pastor, then they send it out. All right, it's 10:30 now. Maybe we'll have the very last question. I know somebody from the back put his hands up already. I think he hasn't talked for a while, so I'll give him time to speak.
Thank you. I think I'll move it. But after I started feeling from this exercise, people have been moved. Don't be moved yet, because tomorrow is the time that you'll be moved, because that will be the actual thing that's going to take place. However, this is imaginary.
Yes.
If I'm saying it the right way. But you'll be really moved when the guys come around to assess you, because they're going to assess the whole thing. So hopefully with that, maybe you can have your tea.
Good one. Thank you. All right. We'll take a break.
On the 30 minutes, please. I feel like 1 hour. 30 minutes.
All one group, you plus staff, Dr. Vetasol. You can look in charge of another group, Dr. Digat laptop. That person saling email address them come so. Pamla kumatin template do. Make me see lot. Time we come back and assessment tomorrow. Kasi tin to so one saling mixing them. So all group members will also Digat laptop namin laptop. That person give us the email address. Thank you.
So when you go to the health facilities, the important people are the in charges. You must talk with the in charges, and then if you're doing a specific program, go to the program site. Make sure you assess the facility, the books, the records, while you're asking questions. And then come and sit down, and then you do your scoring. If you're going to the mother MCH clinic, go with the in charge, and then look at everything. You know what to look for. Look at everything, look around, look at the beds, the booklets, the records, and then you guys probably look for a space within the facility, and then ask the specific questions. If there is some doubt, always go back and check. It is going to be easier if you guys are within the facility. Okay. Now, as I've said, if you go to a level 4 health facility, you might not be happy with the questionnaires, because a level 4 health facility, we expect an operating theater, delivery beds, general. So the questions haven't captured them yet. But go with this one. We are working on it. We will change it to suit level 4, because level 4 are district hospitals. Doctors must be at the district hospitals. X-rays must be there. Pathology labs must be there. And they must be in standard. Public health services must be there. Right? We have all the programs run from level 4. You continue with the booklet, make your assessments, make your recommendations. That's why they say peer review. Peer review is done by experts from different organizations, or experts from the same expert, health expert, going to different health facilities assessing. So you are experts from different facilities going to certain facilities. So you have a better understanding of the system. So when you go there, make sure that you are not going to destroy or spoil or make a bagaradum on the facility. You'll be honest enough to give honest grades, honest scores. In that way, you are assisting the health facility. Also, master mi storia, on the blood bank manager, I'm talking to me by retire, and money I'm go assessing him on the leader montoya. So, talk pisin go money, and people must have true straight there, so I'm giving just compromise and give him score. Now, present time, I'm looking also above 60% now, I'm talking. Me give him this line. Even though this line start, me give him because I'm losing work now. And me like him, I had good planning before them. So, on this like something, me PNG, by you feeling, by you looking, you go and first, by you must smile. You must smile, but talk of sentence and by enough smile by you. Sentence and different. So you must make him good, but you like some certificate on this name, blah. But you like some certificate on this plan, so that you are a recognized surveyor in your own province, in your own PHA. So next time PHA, like working by using the plan or selling or different facilities classes. Okay. So that's very important. Now good plan, so you plan working this exercise on night now, you plan looking end result there. By you mean making it. So data is important. One data you are writing good straight no good blah. So you may come back here and you may see none one time. And by you enter in the computer. No can worry no computer. By you line blah. Usa dino sabe. Usa sabe and by you enter. Important something and work no book pastor. Book is important. You may call up no computer and plan the line, plan the something you know work good. Basics you must understand him good. You must line him on something basic good. Now you may go advance. Lagi time you may go advance. Hari up thing of some over line and sabe. Now I'm breakdown of system come up. So easy, step by step. Now by me you understanding this law, by you now work on computer, and then you making good. By like give him templates how you by organizing presentations, blah. No good. You need lose him now, and you want to 30 plus slides like all day. So we will have to make sure that everything is guided, so you yourself you understand and you deliver appropriately, capturing the important things. All right. Any questions? You got some last scheme start? Yes, there's a mic. It's like mic on the road there. So protocol one there.
Mika ko bas control. Bito take you lo plan your experience line. Or look in this tool na working comments. Thank you lo malaria na. Turing na asti ol narpa ya top lo matres. Ogara morai. What time Mika ko ask him lo site lo waste. Waste you need to talk lo all the observing according to protocols na guidelines. Green bin na yellow bin na popular. But come lo incinerator on narpaya. This la guidelines, la protocol ba only kum lo wanema na how ba save lo ba observe. Thank you.
Maybe I ask him to line. Robert, are you able to answer that question? IBC question. Waste bins and guidelines. As far as me survey, I may work on COVID-19. We live no clinical site of COVID. Na inogat waste management policy in the country. Inogat. Because there has to be, you must get one overarching waste management policy. As they plenty important long issues or raising. One of by discarding on machineries or equipment or X-rays. There has to be overarching policy that governs how we dispose. And that also includes medical generated or biomedical waste as well. I understand that there is no overarching policy. But there are some standard operating procedures, how biodil want them, yellow bin, green bin. I think there are some standard operating procedures. And I also know that there is a IPC policy that has already been done. So there is a IPC policy. Betty, Peter Pindan, I think Solomon, Robert Sidam, on lead long IPC, infection prevention and control. Now I'm working IPC policy. So maybe I will, when Peter is here, I'll let him go through specifically for you. Because I understand there is an IPC policy already in place. So, but generally, we don't have a waste generation, waste disposal policy that governs the health system. So you mean like no plan something? Plan the policies you may not get yet. Sorry, I'm saying me talk personal. Me no boss no. We try to work in lately work no side no working on policies too. But may not have authorities, so I'll leave it to the authorities to do that for us. Yeah.
Okay, in regards to your question, IPC and waste management, Sister Betty Mundua, I'm sure she has developed some SOP for IPC. We've got a policy for IPC already in place, but we're still working on the guideline and it's yet to be approved by the SDM at the department level. But with IPC, with the segregation, it's spelled clearly in the IPC policy. You segregate with yellow bin for waste, hospital waste management, you have green for general waste. So it's in the IPC policy, and with that policy, I think Sister Mundua developed the SOP for Enga PHA. But we are yet to give the provide a guideline, national guideline. Thank you.
Mundua, did you want to say something? Oh, sorry to put you on the spotlight. We are talking in regards to IPC waste generation, segregation, disposal, and the policies behind it. So if you find, if you find that the IBC policy is not in the health facilities, then by you give one and zero. And they give zero. So better by make sure that my data can be IBC by zero and by the pressure or better so you can provide them on this plan. So an example that's what
All right, thank you. In terms of policy guideline or the SOP for waste management, we in the country, like you want to standardize because we are all dealing with the same waste in all healthcare facility. So therefore, the policy to come up, the policy, we already have a policy here, infection control policy, but we have to come up with a guideline with them taking time long National Health Department. But on the other side, with the partners that we have who donated the COVID-19 incinerator, the World Bank who donated a COVID-19 incinerator, also initiated that we also come up with a waste management plan. And that we did 2 weeks ago. We were down in Mosby for a week, and we have already put in place, like for Norway, there is already a waste management plan in place. At the same time, standard operating procedure as well. So here now, the team down in NDOH, they're also part of the World Bank with the partners, so all by all other stakeholders and other business partners who are also dealing with waste, so they get a few ideas from them, making good this like plain Loyomi. So we have a standardized way of dealing with waste management. Instead of one PHA got one policy now, SOP now, another PHA got another. We are all dealing with the same. We are talking about standards, so we are trying to standardize few things like that. So in terms of waste management place, yes, Morobe has one in place, and SOP, we plug out this stuff. So that as part of the assessment, we plug and just, we don't have it on we don't have it in the facility. We have very small ones like legal SOPs, but we don't have a big plan that covers all areas of waste management. So in that area, you can make him, but not a bookie stuff, so probably it's partially should give one for that because you are doing it, and then you can explain on your remarks on the other side. Yes, so emphasize on waste. But in general, for IPC itself, the guideline is still in draft form. It's still in draft, so I don't know when. If Mr. Pinden here is the right person to, answer Mr. President Loyimi, but it's still in a draft. Okay, all right. Okay, Robert, it's before the ACM's approval, so that's a good news for us. So we'll have a guideline. It's a standardized guideline too, so all the PHAs too follow the same guideline. We have the same policy, same guideline. Now you may work in same plus something plus all instead of doing something or something differently. So standards. Thank you.
Thank you. So I hope that answers your question. All right.
Thank you. Nilanya wamba something like Yahweh. And nice Thomas. Especially law. I'm talking about EPI now, so. Me are in this last assessment law, one group on Makila EPI. Well, women are good. Why? Because we had a training conducted last year, immunization and supply chain management, standard operating procedures was done for all the facilities that came in. So timing haram molasses no logis lawan facilities where you may just fire castle or you may pick one the facility loan. All the facilities on the one go down. Now lawyer pinpointing maybe tally sheet you got a one. Everything was done. Okay, so and tomorrow we probably will making money now. So please be mindful that EPI we are making everything we are training finish. So when the
assessment comes in, and by the time the people are looking where supportive supervision will be done. Strong can one up where weak areas and stuff. So that one will line in. So from the practical dynamic thinking out there, I have to be down at the facility, helping those ones that came in for the training to do refresher training for the facilities because some judges didn't come, the AGMs didn't come, so it's my responsibility now to go down and do in-house training with them. And one person thing will line in, so thank you.
Lord, Bello to name you the
Thank you. Comment or question, all right. I'm finish also long side long delivering practical management. Yeah. So if you have any issues, you guys have our numbers. Contact us. I'll leave it to Stephen. So am I talk something on next program after this.
I'm starting in the morning and thank you, Tim. Thank you, Solomon. Thank you, Robert. Thank you, Doctor. Okay, and basically, I'm synthesizing minutes long. The scoring one, it's a simple thing. It's just a matter of you understanding it and correcting it. I just want to add on. It's a very good point, Sister Orebutna. Ginami Tokong. There are some facilities by go, there are some things that you think by stop long or you think by only practicing motion, but you know stop. If there is a question related to that, you make a comment. If you do a scoring, make sure you make comments. If you give a 2, you must talk also why you give him 2. You must talk, ano mas long is la facility 2. Also what keeping good is la record. Only working good is la practice. Time you give him 0, you must talk why you give him 0. 0 in that value belonging. You have to tell this facility that this, you have to correct it. Sometimes we get information. You know why I decided to ask SEM to have the standards material in this format? Because I went on a site and this information were already disseminated to district health managers. Unfortunately, it was an electronic copy. That electronic copy in a rural setting, you don't have it disseminated to your subordinates. So it was sitting there. We gave a scoring 1. Why? Because it's got the information. Unfortunately, that information didn't reach out to its subordinates. So we advise him to find a better way to get his information disseminated. That's why you have this material in a glossy paper, so it's easier for you to print and make it available for your subordinates. And standard law. You know, constitution law properly or some lines or seven or the line no seven. The standards belongs to all health workers in every health setting. They went and they waited for Stephen now to ring the bell so that everybody will come and gather. All right, we will do that. There was a delay basically because I want to run this so that we run them both parallel. Makes it easier for costings purposes. So when you are on sites, sometimes we have subject matters like Orobuti Todoga and touching area belongs there. Shem looking Islam but you hold it. Maybe you bring all participants come there, you talk about good plan talk yeah. Time will go back in there. This is talk blue must lose road not go come up. This is an opportunity for you to go and say, okay, we've trained you on API. This is starting training on API. I'm talking about meeting too or not that. So you saw it. You bring one of candidate to come to training. So it's maintain an open mind in the facilities that you are doing. Some of you are going to the facilities that you stop long. You can be an observer around that one and allow neutrality others to do the survey for neutrality. Be very open because this baseline assessment will help us. It is important for our district hospitals, Muching and Buloro. And then you may call it district hospital. National Service Standards is not fully recognized as a district hospital. This survey will provide us the basic information that we will utilize to substantiate, to present it to the government agencies to recognize it and support it with human resource and other facilities. And that's why we beef him up on line. I'm confident it's not only that 2 facilities or Arabla 2, because it's important for lay DDA when they sit to make decisions, they make decisions based on the evidence that we provide. So I want something to encourage people locally. Maybe I repeat me again, you don't go and make comparisons. Don't say in Buimo Health Center, we plus up to date one time annual meetings from there. Why you Pulolos are not doing it? Why you just go and observe what they do? Be very fair when you give them the scoring. Be very fair. All right. But me to thank you, team. They've made it very easy. Sorry, I had 2 hours away because the decanting. All block Warawinya, but I'm starting so we need to run to have a meeting to see how fast we go, so that we'll have the Guarawing cleared out so that the developers can come in and refurbish it for other purposes. But thank you, Rafael. You want to comment me or you want to ask me a question?
Thank you. Sorry. I think what he make mention of it, but for the sake of those who were not attended review last year, can you suggest a checklist there? And we will go based on it's like general. But if you have the minimum standards, that soft copy either, that will help the officers to assist when they are practically down at the facility. That will help all in up because something or assessing grow. When in there, a post all up in a center, no they assess them wrong. So if that will help us or help them to assess the facility as well. Thank you.
Thank you. Hello, please, sir. 20 minutes.
Okay, thank you. Plantelan toto lo kisim sa template lo database ya. Pamplan na dim. Okay, di sa spreadsheet ya pamplan photocopy na checklist sorry. Pamplan dim copy na ita ke yo kim la bisa anta lo kan right lang. Pamplan ke copy. Okay, lo template wala ma template ba mi plan lagi bang mo kim manually ben ba teste ba mi. Betul lo template na. We plan making something easy. We plan to test for you. We can discuss with you and enter him direct. We plan again. Email cam loyal. We plan again. We plan again. You may consider the manual past then. Testimony, but you can go through template. I can enter him. Now you can present him. Thank you.
I'm clear, sir. No, me talk na may process lang good la talk na mo bilis. Joshua will duplicate make copies of the checklist and give Luibla. But it's good to use the book as well because it's written right there. But it will make those copies available for you to use for convenience. Once you capture all those, do the assessments, you may come along test day, they will walk around and you place in groups as well, you go through solo, enter transfer it as well, go electronic copy. And by easy strategy. No give me one, I will come one, but in a complicated system. Logistics, the travel arrangements after lunch, we will update you on the how we will be deploying you and extracting you to the sites for the civil sites. So after lunch, I think that's not much. We can break early for lunch and we can gather here at 1 o'clock. 1 o'clock people come straight because I'm thinking if one team, we probably might disperse them earlier than before this afternoon. The Punono team. So it's better if they come quick so that we can sort of get through this and then get them dispersed. Thank you. If you have any other further questions, you see me, you can raise that after lunch. Thank you. Can I have Sister Mitchell, you want to say a word of prayer? You want to say something?
Sorry, this is apart from the standards. But if you look at WhatsApp, misalnya mau tupla budget. One plan April, June, August. One plan May, July, September. This is a budget misalnya lo periodic intensification immunization program. It's a 589,000 money where WHO is giving blow. One patrol team inside long one district where out hard to reach. So patrol. Only one patrol team. That budget, and we got number of days, Hamas will go out, but car, boat tire, one. This afternoon, lunch by me printing copy, want RHCS. Some are already submitting RHCS. Please, to those health facility or DHM, please, you look at district you will performing this program next month. Submitting some, thank you to some who are already submitting, giving me penis. The money is already here, HSIP account. So it's a one week or one patrol. The other patrol teams, AHISS Valukauting. But the same patrol team, by you making same one long May, supposedly April, by you making June, na by you making Ken long August. Same up you go long. So it's 3 times you are visiting those villages. Triple time. Except for Lay District, for Gagidu, Bulolo, Moroben, Salamawa. All this line by all no step inside. AHISS but take care long. I will be giving you RHCS and the hard copy of the budget after lunch. Thank you. Any questions? Come give me. Thank you very much. Emphasis. We pray. Okay.
Sorry. no get lost in you plus sit down, you plus get a call or health facility. Start no gate or one block good lab like send photo play you plus one them. So you plus present time and by one plus slide and photo and the health facility. So kisiman block good la photo a smile, a staff good you plus standard slide now.
Thank you. I think 4 or 5 hours you may sit down. Please, me asking you, you'll get a lost sana. I think it's your wafi and must get like one platter. Yeah, me like baitin lo kai now. Okay, me go to down in na pray. Papa God long heaven, me talk thank you this morning. Me play been sit down, harim, all talk. Me play make you man talk, you been give him long all facilitators, me plan and me play go through long me play talk thank you. Papa me play talk thank you, this breath of life you give me play every day. That me play can still pulling win and me play stand. Papa God without you, no got want something by me play making but even everything is impossible, but through you, God, everything is possible. Papa God, let us thank you. Nami plalusim. Lansa walawan, lo you wanam kai only prepare him. Thank you, Lord Islam. Blessing you, give me every day. Me pray on top of this la kai when him something is stirring inside Lord this la kai whereby making me plus sick. Papa God, me rouse him, the holy blood you. You bless him this la kai bless him, Musati, prepare him. Now all hard work, lo come up in this la kai now by me practicing. Bless me plagata families pla me pla. Na stop one time me pla. Today na always. In the name of Jesus me pla pray. Amen.
Can you be in your groups? Okay, thank you. We will go into the logistics and arrangements for deployment. All right. Bulolo, Muching, and Mumang, you will have 5 brigades joining you.